in the Mount Sinai Health System, and I specialize in epilepsy. So that's a good question. So when we think about people who have seizures or epilepsy, the goal is obviously for every person to stop having seizures or epilepsy. And we are usually pretty good at getting that with treatment. And so a breakthrough seizure would be any time that you had a seizure unexpectedly. So the goal is that your seizures stop with your medications and or other treatments. And if you have a seizure, then that would be considered a breakthrough seizure. So breakthrough seizures can happen for many reasons. Probably the most common reason that people have breakthrough seizures is problems with their medications. So either problems getting their medications, forgetting to take medications, or some other new medication or something else interacting with them and causing decreased lower levels of medication in their system. Other common causes that our patients run into are lack of sleep or stress can increase your risk of having a seizure. And sometimes even other illnesses. So anytime that your body is a little bit stressed or weaker in some ways, you can have breakthrough seizures. So excellent question. And so part of that is working with your doctor to figure out what was the cause of the breakthrough seizure and what needs to change. So for example, as I was saying before, if you realize that the problem was that you ran out of your medication and weren't able to fill it in time, then figuring out a plan so that you can always make sure you have your medication on time. If you realize that the problem was that you started a new medication and your levels dropped, then your seizure medication might have to be adjusted to account for that. Some people, as I said before, notice that they have seizures when they don't sleep well or up late. And so for that, being really attentive to sleep habits can help. For other people, they notice that if they take certain over-the-counter medications or if they drink alcohol, they have breakthrough seizures. And again, that is to notice that and then to avoid those things. And then finally, if there's not really any identifiable trigger for why you had this seizure, then it might be that you need a little bit more of whatever treatment you're on, or that you need a different or additional medication or type of treatment for your seizures. So I think that sort of goes along with talking to your doctor about why you and they think you had one, right? So again, if we think it's some obvious or identifiable, maybe not obvious, but in retrospect, when you think about it, if there's some identifiable reason that you had the breakthrough seizure, then you should address it that way. As I was saying, it might mean having to adjust the dose of a medication, avoid certain over-the-counter medications, take really good care of your sleep, or if there's not an identifiable trigger for why you had the seizure, then you would probably want to have a discussion with your neurologist about whether you need a higher dose of the medication you're on, you need to try a new medication, or you need to try some other therapy to help with your seizures. So in some ways, yes, right? So if we think of breakthrough seizures being any time you have a seizure, and the goal for everybody with epilepsy is to not have seizures, then if you're having ongoing, like frequent breakthrough seizures, then we would say, and you've tried more than one medication, then we would say that you had drug-resistant epilepsy. So having drug-resistant epilepsy just means that you've tried at least 2 medications and that they haven't worked for you. Because we know that somewhere between 70 to 80% of people will respond to either their first or second medication. It's important to remember that the goal for everybody with epilepsy is to not have seizures. And that's our expectation for treatment, is that we try to reduce and ideally eliminate all of your seizures. So anytime that you have seizures, your neurologist wants to know, because we want to try to figure out, as I was saying, why we think you had that seizure, and then what can we do to help you not have any more.